Welcome to the Pacific Research Institute podcast. I'm your host, Rowena Itchon. Our guest in this episode, and a PRI frequent guest, is Wayne Winegarden, Senior Fellow in Business and Economics at PRI. Wayne's new study is called Promoting Access and Lowering Costs in Healthcare, the case for empowering pharmacists to increase vaccination rates. This season was an especially tough flu season for the U.S. Unfortunately, our nation's vaccine rates are unacceptably low. Too many people become sick, are hospitalized, or die from vaccine-preventable illnesses each year. For example, about 900,000 get pneumococcal pneumonia each year, leading to 400,000 hospitalizations and 19,000 deaths. My colleague Tim Anaya, PRI's Director of Communications, and I discussed with Wayne his research on why empowering pharmacists to administer vaccines could go a long way in reducing flu, pneumonia, and other preventable illnesses. Thanks for joining us. Welcome back to PRI's podcast, Wayne.
Thank you for having me, Ro.
So vaccines have gotten a lot of publicity in recent years with a controversy over Hollywood celebrities telling parents that they shouldn't have their kids vaccinated for fear of getting autism. There was a very controversial bill on mandatory vaccines in California a few years back that drew intense debate and national media coverage. So where do things stand now in this ongoing debate?
To call it a debate almost it gives too much credence to those who are against vaccines. Vaccines have been kind of labeled as one of the greatest, health kind of promotions, health advances over the past, centuries. I mean, I think they maybe rate clean water. After clean water, we have vaccines as kind of an improvement in people's health. And so it's, vaccines both as kids, which is what this is referring to, but now as we've developed all of these adult vaccines, as adults, when you talk to anyone in terms of the medical professions, they'll tell you how important that is for not only promoting individual health, but also for containing outbreaks. So I hope where things stand now is that people are realizing how important vaccines are and how important it is to have an efficient kind of market, if I can use that term, for vaccines where we have the lowest amount of access barriers for patients.
The other concern that we have now with vaccines is really over public health, and there's a fear that these stories from celebrities are really scaring people away from getting the vaccines that are recommended by the CDC. So how are we doing today? Are Americans getting enough of the recommended vaccines to protect our public health?
No. We have very good vaccination rates for kids, although that debate has worsened it. And you started seeing some, measles or other things kind of popping up because of that. But for the most part, because in order to enroll your child in school, you need to get the vaccination, it's not as much of an issue. On the adults side, right, and so the CDC has goals for adult vaccination rates, and there has definitely been some improvement. The flu vaccine is something where, a large majority of Americans are actually getting that, but it's not at the goal where CDC would want it to be. And when you start looking at other potential vaccines, like for shingles or for the pneumonia, particularly pneumonia for people aged 65 and older, where they're at particular risk, we're falling short of the CDC goals. And so a lot of the benefits that individuals can get, and again, as kind of we can get in terms of containing outbreak, those benefits aren't being reached.
When your study focuses on the laws governing who could administer vaccines, so let's start with the basics. Who can administer vaccines and who can't? Are there differences in who can do so in each state? And why was the law set up this way in the first place?
Right now, the vaccination, it's a state. The states have kind of the ability to determine who cannot vaccinate. So obviously, your doctor nurses, they can vaccinate as well. But there's been a growing trend where pharmacists have been providing vaccination. And I think, the greatest success I think you could see is with the flu vaccine, where many people are going to go to their pharmacist to get the vaccine because it's cheaper and it's more convenient. There's, you don't need to make an appointment, all of those types of other convenience factors. The reason we focus on the pharmacists is because while many states allow pharmacists to administer vaccines, how they allow it varies tremendously. And those kind of variations creates real barriers. So maybe on paper, you have a pharmacist that can give a vaccine, but in reality, you can't. That type of kind of growth in the pharmacists giving vaccines, we've seen some real promise with, but the state-by-state laws, as it currently exists, has created a barrier to greater kind of administration of vaccines by pharmacists.
When hearing that, our listeners might be a little concerned about having a pharmacist giving them a vaccine and not a doctor or a nurse. So can you describe, what sort of training do pharmacists receive on administering vaccines?
In most pharmacy programs now, actually kind of being trained upon how to administer the vaccine, it's actually part of their kind of education program. And in fact, there have been some studies that have shown that the CDC, they have their protocols that you have to follow when administering, and that the pharmacists have been adhering to those even more closely than other healthcare professionals. So they are not only trained to administer the vaccines, but they've been shown to be able to do so kind of safely, effectively, and following the kind of the protocols that the CDC has put on those vaccines.
Flu vaccine rates are the highest levels because it's so convenient to get one each year now. They're offered in doctors' offices, clinics, pharmacies, even Costco. And I remember when PRI's offices were at the Embarcadero Center, I actually got my vaccine at the lobby of our building. So that begs the question, why is it so easy to get a flu shot, yet so inconvenient and expensive to get virtually every other vaccine? And how would reform make it easier and far more convenient for adults?
Ro, with that question, I think you're getting really to the heart of the question here. And if I can back up for a moment, one of the reasons we took this paper on was because this is an important issue in and of itself, but it's also an important issue kind of with the healthcare system writ large, right? Often when we talk about healthcare reform, we focus on payment, right? How can we change how we finance, how we pay for healthcare? Incredibly important and absolutely necessary to do. But there's also a lot of benefits we can get from changing how we practice medicine. There was a great story I read where imagine somebody from the 1980s or the 1970s coming to the world today, and so many things would mystify them, right, in terms of the internet, mobile phones, and all of these things. But if they walked into a doctor's office, things would be quite familiar. And so I think having to kind of update kind of the practice of medicine in terms of the world today is incredibly important. And so this topic is an example of how we can change the practice of medicine and improve costs and improve outcomes. And so I think that's incredibly important. So now, if we kind of get to exactly what you're saying, in terms of the flu shot, that was one of the first vaccines as kind of the pharmacists have had the ability to administer vaccines. That was the first one that they've been able to do. And that's also the one compared to the other vaccines that has the least amount of barriers. And so when I'm saying barriers, what these often are, you have to, in some states, a pharmacist can administer any CDC recommended vaccine to a large extent. Other states, you have to actually get a permission or a prescription from a physician in order to administer the vaccine. And that can change from vaccine to vaccine. So what's true for the flu vaccine might not be true for the pneumococcal vaccine. And so typically you have fewer restrictions on the flu vaccine, which I think is part of the reason you're able to have that more conveniently and you have a lot more success on it. But imagine you have to get a prescription from your doctor before you can get the pneumonia vaccine. Well, that takes away a lot of the convenience that the pharmacy can offer to you. And as those kind of requirements in terms of vaccine increase, the benefits from getting it from a pharmacy will go down and the cost on the pharmacists to administer the vaccine will go down. And so that's why part of the reason you see more success in flu and less success elsewhere. But it's also in terms of the reforms where we kind of have to ideally push the system so we can actually get better vaccination rates across these vaccines.
So one of the areas that your study explores is costs. So how do costs for vaccines compare at a doctor's office versus a pharmacy? And what explains that cost difference?
There's been many studies that kind of have looked at kind of what's the cost of different vaccines in different settings. things, and they found, 10, 16 to almost 25% difference in the cost in the pharmacy setting as opposed to the physician's office. And a lot of that comes from the efficiencies that the pharmacists are able to enable in their lower kind of overhead costs, their ability to manage the cost of the vaccines, right? Often you have doctors, when they cite, some of them don't, or many of them don't carry all of the CDC recommended vaccines. And part of the reason is the cost of, and especially if you're a smaller doctor's practice, you're not going to have the scale to kind of in terms of managing those costs. Pharmacies are better enabled in terms of that scale to kind of manage the costs and therefore able to administer them just as efficiently, if not more so, and at lower costs.
One of the main issues with healthcare in California is a lack of access to healthcare in rural communities in our state. You make the case that reforming the law for pharmacies and vaccines will increase health access in rural parts of the state. Can you tell us a little bit about that?
Oh, absolutely. I mean, and I think this is one of the most fascinating parts of this kind of study, and one of the things I learned in terms of going through it. And it actually makes sense. I mean, think about how close your local pharmacy is, right? Whether it's kind of one of the Walgreens or CVS's or just kind of a local community pharmacy. I mean, typically those are all within very convenient distances. So even within an urban area, often it'll be easier to get to a pharmacy than to a doctor's office. But now imagine you're in a rural area, right, where the access to kind of health facilities there's just less access. You're going to have a lot more convenience and obviously a lot more locations for these pharmacies than you're going to have in other types of medical practices. So it's just a matter of kind of it's where you're going already. You have a healthcare professional in the building, so it's a significantly more kind of convenient location. And importantly, when you look at kind of the demographics of vaccination, you actually see a statistically significant difference between vaccination rates in rural areas, which is lower compared to urban areas. Not only kind of does it kind of logically make sense, not only do you have the convenience, but you actually, if you want to increase vaccination rates, this is one of the populations that we need to target in terms of, getting over the barriers that are preventing them from getting vaccinated.
So, Wayne, if there are so many advantages to getting a vaccine at a pharmacy, why haven't reforms already been enacted into law? What's stopping them from happening?
Well, I think that we've been making progress in this area. So if you look, 20 years ago, maybe only 9 states allowed pharmacists to administer vaccines, and that's been growing. So now pharmacists can administer in all states, although there's the restrictions, whether it's a protocol that has to come from the state or from a doctor or having to get the prescription. And there's other types of reporting requirements. So I think part of it is just education and kind of putting out the information in terms of we have the results, we can see the effectiveness of these providers in providing vaccines, and that they can do it in a low cost. But I think part of it also is having to create a kind of national standard so that if you're a CVS or a Walgreens and you're working across all 50 states, to have one kind of protocol that you follow across, that's going to create a tremendous amount of efficiencies and scale that you can then use to kind of A, lower costs, and B, kind of get more vaccination services out there, and also help educate patients in terms of, okay, these are the types of vaccines that the CDC is recommending that you have, and obviously they need to confer with their doctor as well, but there can be an important education component from the pharmacy that they'll be able to achieve those benefits. So I think we've been making progress, and what's stopping, I think, is that if we can get over this kind of varied, kind of very complex environment and just create that kind of national reporting requirements and national standards where you have all CDC recommended vaccines able to be administered by pharmacists, that would go a long way in terms of increasing our vaccination rates.
Wayne, if you were to reform the law, what impact do you think it would have on vaccine rates in America today?
I think just Econ 101 would tell you if you have greater supply, right, and then also through education increased demand, you're going to have a greater quantity, and depending upon how those curves shift, you can also have lower cost feasibly. And so I think, that would be the expected outcome, right? We're going to get greater efficiencies, lower costs of administering the vaccines, and higher vaccination rates.
Finally, Wayne, based on the findings of your study, what specific forms would you recommend that states and or the federal government adopt to make vaccines more convenient and affordable?
Well, I think the first thing, which I had just mentioned, is we need to create kind of the nationally consistent, streamlined kind of ability for pharmacists to administer all CDC-recommended adult vaccines. They shouldn't require a protocol or a prescription from a physician. Now, they should, of course, be held to the exact same accountability and reporting requirements as any other providers. You have to hold the pharmacist to the exact same standard. I think that's obviously very important. We also need to create kind of a nationally consistent, kind of streamlined reporting requirement. Obviously, when you give the vaccine, that information needs to be reported in. And I think that regulatory burden has to be minimized to be as low as possible. And then finally, if we can enable pharmacists to educate patients so that, if a patient comes in and you see they haven't had the pneumococcal vaccination, that they could educate, well, here's the benefits. If they could then tell the patient, hey, look, you may not be aware of this, right? But, the pneumonia vaccine actually, it impacts, about 900,000 people a year, right? About 500,000 are hospitalized and 19,000 people die. And so that if you can have the vaccine, that'll help protect you, and not only help protect you, but help protect others against this, disease. I think that would be, very impactful and, again, help increase the vaccination rates in the country.
Thanks very much, Wayne. Thanks again to our guests, Wayne Winegarden and to Tim Manaya. To download a copy of the study, go to pacificresearch.org. If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, or TuneIn. And please do us a favor and give us 5 stars. You can also listen to our podcast on PRI's YouTube page, youtube.com/PacificResearch1. That's the number 1. Also, check out our blog Right by the Bay on our website at pacificresearch.org. Finally, if you're in the Los Angeles area, please join us on June 29th for a discussion and luncheon with Andy Puzder, former CEO of CKE Restaurants. You can find all of the details on our website at pacificresearch.org. Thanks for listening. I'm Rowena Itchon. We hope you'll come back again for another episode of PRI's podcast.